Welcome to the broadcast. You're listening to Knife After Death with Dr. Darin Wolfe.
Say, did you ever hear the saxophone let out an awful moan, let out an awful groan? It makes you feel so nervous, yet it's great.
We are back once again for another exciting episode of Knife After Death. What I think is probably the best podcast in forensics, but I'm a little biased. No, we're trying. We're trying to make it better and better as we can. I've been super busy, and it's been hard for me to, be as put out as many as we have been before. But we're working on it. We're working on the backdrop a little bit here. We've got this guy. I don't have a name for this skeleton yet, but we could probably take names, requests for names from the audience there. Yes, we're back with Jessie here. Jessie, any news?
Actually, no news other than just a bunch of people being ridiculously sweet, and yeah, just excited to do another Q&A episode.
Yeah, so this is a Q&A. I do have a couple of comments. One, actually, I think I have three comments. So the first is I got, and I think you did too, a number of messages about the Beethoven episode.
Yes.
And people really liked that. And I'm happy that people really liked that, because when we hear from you all, it helps Jessie and I say, well, maybe we're going to do more episodes like that. Maybe we're going to do more historical pathology, speculative type episodes. So I suspect her and I will probably comb the annals of history and see if we can find some good topics there. That's an episode I had been wanting to do for literally 2 years, and I just never got around to recording it. So I'm very happy that people received that well, received a lot of nice comments on that one. The Ellen Greenberg episode keeps coming up for me, and I've had a couple of people write me, and this is actually what makes me happy, is they've written me and said, I didn't realize how much information was left out of my knowledge of the case. Not me as in Dr. Wolfe, but me as the listener. People said, I didn't realize how much we aren't told, and after you explained it, now I understand why the conclusion is what it is. Because, when you leave out a bunch of variables, you can make people believe anything. So I've had a number of people, really nice, long, well thought out messages about how we approach that case. And, I don't really, I'm not trying to just beat the table and say, look, I'm right about this, but I like to explain why things are called the way that they are using my knowledge within the field. And that's basically what we did for that episode. And so the primary conclusions for that, it makes sense from a forensic perspective, but it doesn't make a lot of sense if you don't work in the field. It seems, it's really hard to take. And I think that's why there is some pushback. We get some comments that are kind of angry about that episode, but I think that's par for the course with any controversial type death. You're always going to get people that refuse to break away from their held notions, their conspiracy notions, and they want somebody to be guilty, because when it is a case of self-intent, let's put it that way, because there's certain words I can't use or the video gets banned. People don't like that because there's no justice. And to that I say, unfortunately, the world is somewhat unjust. Things do happen where justice does not, there's no balance there. There's no scale. But I appreciate everyone who's commented on that, even the people who are very angry and mad and say that I don't know anything. Where they've done 0 autopsies and I've done 4,000. But there's one other comment I want to make, and this is a funny one. So yesterday I was doing a live stream on TikTok, which I don't do very often. I maybe like once every 3 or 4 weeks I'll get on there for like an hour. And someone, and I'm sorry I didn't get your name, but if you're listening, I found it very interesting. She said that she works in a salon, or she owns a salon, and they listen to our podcast, Knife After Death, while the ladies are getting their hair done and their nails done, and they're listening to us. And honestly, I thought that was really cool because I sort of picture when people listen to this, I guess I sort of picture just people driving in their cars or people vacuuming their carpet or whatever. But the fact that we're actually providing some sort of entertainment for people who are getting their hair done, I don't know. I like that. I think that's pretty cool. So I didn't get your name. I didn't get your name, but if you're listening to this and you want some stickers or something like that, message Jessie, who she has an Instagram account for this called Knife After Death, and also you could just message Jessie herself and say, "Hey, it's me." Now, if she gets 20 messages that says, "Hey, it's me from the salon," we're gonna have to actually tease out who's telling the truth. But with that being said, yeah, with that being said, we have we're ready to go for today's Q&A episode. We get so many questions about the stuff that we do that we have like 5 episodes worth of material, so we're just kind of ticking them away as we go. So I think we're ready, Jessie, if you want to kick it off.
Absolutely. Okay, so this one is from Lisa McCauley. Have you ever done an autopsy on somebody who had tapeworms? If you have, what happens to the worms after the person dies?
Okay, so right. This particular question does come up a lot, and I want to first address why does this question exist at all? Uh, Tapeworms, of course, that's a real thing that people can get, but the question exists, I think, because right now, at this time in history, there's a lot of people out there pushing that we are filled head to toe with parasites constantly. We are completely filled head to toe, and those people also always seem to have a special tonic for purchase to take so that you can, quote, cure yourself of the tapeworms, of the parasites, and things like that.
A
So the
snake oil,
reason
if you
why
will.
15 years, yeah, right. So the reason why 15 years ago I got that question never, but now I get it literally every week, goes to show you the power of marketing, really. So let's just answer the question straight away, and that is no, I have never done an autopsy on somebody with tapeworms. Number two, can somebody have tapeworms? Of course, that can occur, but it is actually very rare these days. In this particular country, which is the United States, I realize that there are people who listen in other countries, but we have done such work on sanitation. We have done such work on, kind of like food preparation and knowing how to cook food and things like that, that it's vanishingly uncommon. You have to go kind of out of your way to get a parasitic infection. For instance, killing an animal and eating the flesh of that animal without properly cooking it, you definitely could open yourself up to getting some parasites. But who's really out there doing that unless you're like the HHS secretary or something? Um, but the other is water. So, clean sanitation. So if you go and you scoop up out of the creek, I've got a little creek by my house, and sometimes, but I don't ever feel like I need to go down and scoop water out of it. If you were to drink fresh water without, like boiling it, you're opening yourself up to parasitic infections. And I would also like to say that parasitology is one of the most interesting fields in microbiology. I love it. And I love diagnosing it, except that it never happens. It basically never happens at any sort of frequency that necessitates a person to do a parasite cleanse. And I know that I'm a little bit on a tangent here, but I know why these questions exist because people come to me earnestly and they say, I just feel like, I should be doing this because everybody tells me I have parasites. And I can tell you that you don't. But let's theoretically, let's just hypothetically, the second part of her question is, if you have done this and you do find tapeworms, then what do you do with it? So if I were to find tapeworms in a case, I would want to have them properly identified. Now, as a pathologist, we do have training in microbiology. I could try to do that myself, but the easiest way to do it would be to collect the specimen, probably straight away, right out of the intestines or whatever, put it in a little bit of saline, or some kind of transport media, send it to the microbiology lab. So clinical microbiologists, they live for this sort of stuff. But I've had clinical lab technicians and microbiologists talk to me about this, and they said, yeah, we really hardly ever diagnose this kind of stuff. Um, Now, this is where we now get into the but what if? But there's this one case I heard of. Yeah, parasitic infections can occur. They absolutely can occur. They are much more common in the situations that I mentioned. If you're just eating dirt, if you're drinking water out of the creek, if you're not cooking your food, you can get parasitic infections. But in modern America, I have never seen a case at autopsy, and nobody I know has ever seen a case at autopsy. But they are very rarely they can happen. And I think there was wasn't there another parasite related question, Jesse,
There was, I
somewhere in
think it
this?
was from Bethany Sevilla.
Oh yeah. Right. Okay, so I'm basically answering that. So let me just read Bethany's question really quick. She says, "What is your opinion on the presence of parasites in the body that everyone seems to be obsessed with online?" And I've already gave my opinion on that, which is that there's a lot of people scaring you into believing that you have parasites so that you will buy a $30 parasite cleanse or you will buy ivermectin or something of that nature. Um, and one of the things they say, and of course, they attack me because I'm one of the doctors who actually diagnose. And so when I say I don't see it, it makes them very angry. Um, one of the things uh, with that, what they're saying, what these folks are saying, is that parasites cause cancer, and so therefore, if you take the parasite cleanse, you're going to cure any chance of having cancer because you're going to get rid of the parasites. Now, here's where the kernel of truth comes in. There are some parasites that can rarely cause cancer. I've never seen a case of it in 20 something years of pathology, but there's a bladder parasite called Schistosoma hematobium. So usually this is in like sub-Saharan Africa, I think, and basically the parasite you ingest it or it goes into the urethra or something. It'll settle into the bladder, and then it causes like really bad inflammation over time. And what happens is that chronic inflammation for years or whatever may produce a squamous cell carcinoma of the bladder. So technically speaking, yes, you can have that. You can also have something called a liver fluke. Clonorchis sinensis is what it's called, and liver fluke can also, I believe, be associated with cholangiocarcinoma, which is a really dangerous cancer of the bile ducts. But again, I've never seen these in the United States. In other countries, maybe it's a little more common. People who are in areas that are underserved, people where they don't have good sanitation and things like that, you can definitely end up with that. And in very rare cases, you can get cancer. But the bottom line is, I think a lot of it is just kind of like induced paranoia. I'll say, and I know that Jesse's probably going to agree with me on this, that as scientifically minded, logical people, we get called fear mongers for saying things like, you shouldn't pass infections to people. And then they go, you're a fear monger, you're a fear monger. Um, but what really is fear mongering is telling you something that's not true to make you do something against your will. And that would be like saying parasites cause cancer and therefore you should have a parasite cleanse. So, I'm not a big believer in it, but here's where I think they kind of they have you where they want you, and that is doing a parasite cleanse probably isn't going to hurt you. You wouldn't want to do them serially. Of course, you're going to get like dehydrated, or you're going to have some new, electrolyte abnormality or something. So basically, it's just kind of like extracting your money. Pay me, I'll give you the tonic. You drink the tonic. You go to the bathroom. Now you're cured. But really, nothing was done. Nothing was cleansed, so to speak, except, just to cause you to go to the bathroom, like taking a laxative. So I'm not a big fan of that sort of thing. But people are certainly entitled to do whatever they want to do with their money, and with their body. And if they feel like it makes them feel better, then go for it, I guess. But from a scientific perspective, there's not a huge basis for it, at least in modern day.
Yeah, and I actually have, something to say in that in regards to it always seems to be the people peddling parasite cleanses, liver detox teas. Also, curiously enough, these are also the same people fear mongering about vaccines and organ donation. So it's just like,
Yeah.
they have something that they're
Yeah.
trying to sell you. They have something that they want you to believe to make, and I see it a lot
Yeah.
in these weird, like esoteric groups too. It's very strange. And it's just like, yeah,
Well,
like
but
don't take the COVID vaccine, but definitely take your parasite tea every morning or
yeah.
whatever.
Well, and it's the one thing is, like I said, people can do whatever they makes them comfortable. I'm certainly not castigating you. I'm not telling you get out of my face, you're wrong. I'm just telling you that we have to think scientifically, we have to think logically when we approach this, because ultimately, I don't want anybody to be hurt. And I also don't want anybody to be misled. And I think that a lot of it is fear-based. And I don't think it's a very nice thing to do to make people feel fearful in
No.
order to get them to do something. So that's my biggest problem with the approach. Now, if you show me scientific data and you say, "Well, I'm going to show you that this works, and I'm going to prove to you that we actually have more parasites than we do," I'm open to listening to that. But I also have going on 22 years in pathology, which is kind of crazy, actually. And it's just not come up for me in 22 years overseeing tens and thousands of surgical specimens, clinical lab specimens. Um, and actually, most of the ones that I saw when I was at the medical center did come from other countries. People who were traveling either to, Malawi or something, and then coming back home, and they pick up a little something, or sometimes it would be somebody coming here permanently, and they were moving from, some other country, and they already had like an infection on board, and then they develop a pneumonia or something like that, and then we get a lung biopsy, and then I get called in to come and look at it. So yeah, it does happen, and that's where you got to be careful. Is something because it does happen doesn't mean it's common, and so it just at that point you're kind of playing the game of is it do I believe that it's common enough for me to want to buy this product and use it? And do I believe it? So it's really just convincing. And sometimes science and logic, we in that field, we aren't as convincing perhaps as we should be, because it's just not a very flashy thing to say, by the way, I've worked for 22 years in this field and I've only seen a handful of cases where this applies. So, but there may be another pathologist who's worked for 22 years and they've seen a lot of it. I certainly haven't communicated with them. Let's put it that way. Um, but yeah, I think those are good questions. I love talking about parasites in general. It's just not something that we see very much here and now. Like 150 years ago, probably a little bit more common, but today, not so much. Do you want
Alrighty.
to move on to yeah, we can move to the second one, I guess.
Yes. From Ariel A. Do you or Dr. Wolf listen to music while doing autopsy?
So why don't you take this one first? I've never talked to you about this, I don't think.
We
So
have it. Yeah.
yeah.
So yes, I, my thing is I've always done autopsy with somebody. So obviously the pathologist. So, and typically the pathologists that I've worked with, they tend to listen to like oldies, like old rock, which I don't have any problem with. For some reason, my mood when I'm dissecting is the same as when I paint. I don't know what that is. But
Yeah.
so I'm very much into, well, I'm wearing a Peter Murphy shirt, so I'm into like like my home genre, even though I listen to all styles of music. I love pretty much every style of music you could possibly present me. Um my home genre is kind of like that post-punk slow goth music, but one of my favorites to listen to is Motorama. They're a post-punk Russian band that I love them to death, and that's just kind of I love like weird pensive mood that I'm in anytime I'm dissecting, painting, writing, whatever. Same brainwave for all of those actions for me.
Hmm. Well, yeah. So the reason why I asked you first for you to take it that question is the way that I did it is I always let the tech decide if they want to listen to it. Um, and so for years, I worked with a tech, different techs. I've probably had 4 or 5 people work with me, maybe 6 or 8. I don't know how many, but a lot. And so I always let them choose. I really didn't have much of a say. So the techs and we listen to everything. Sometimes people would listen to like country. Sometimes people would listen to really loud metal. Sometimes people would listen to classical music. And I never really, kind of like dictated that. But in the last few years, I have been more of a silent autopsy guy. And so I started to think about it. And I've been in morgues before where people are listening to the music and, they're getting a little too into the music. And I
Mhm.
kind of feel like we need to be focusing on the body, not the lyrics of this song, not this, we don't need to be dancing in the morgue. I feel like
Right.
it's for me, autopsy is a solemn, yeah. For me, autopsy is a solemn thing. It doesn't mean I'm sad. It just, for me, it's a very serious undertaking. And so I personally do not listen to any music. I like the silence of the morgue, the hum of the fan, the buzzing of lights, the dripping into the sink, just my brain and my hands working on the case. I love that kind of silence. I feel like my mind is working best when I'm doing that sort of thing. I'm not totally opposed to it, but I had this weird sort of, philosophical thought about what if I mean, I'm working on this body of somebody who's clearly they died unexpectedly, or else I wouldn't be there. And what if they hated the music that I'm listening to? Like, obviously, they can't perceive it because they're dead. But I always did think, you know, I don't know that I think that it's a little tiny bit disrespectful. And again, most people disagree with me because most morgues, most pathologists and techs listen to music. They fill the space with that. And by certainly to each his or her own, for sure. It's just I take it so seriously that I can't listen to music almost. Now, every great now and then I might do something like put on some classical music, some kind of like Bach, which I love, Haydn,
Mhm.
which I love, things like that, because now that is really that sort of cleanses my cerebral cortex a little bit. But yeah, I can't do it anymore. I feel like for me it's all about the case. And I know I seem high and mighty. I know there's pathologists listening to me right now, and they're probably thinking, boy, this guy thinks he's better than everyone. No, I really don't. It's just, it's personally, it's what I care the absolute most about is doing these cases and getting them correct. And and sometimes, people talk to me about stuff. They talk to me about basketball or football or something happened locally. And I realize it's distracting. And I don't want to be distracted. I want to do a perfect job on every single case. And that's a high standard, a high goal. And certainly, as being a human, of course, I'm going to make mistakes now and then. But I just feel like, I don't know. I feel like it's a reductionist type of mentality where I want like the simplest amount of action going on in the room. I want it to be me. I want it to be the body. If I have an assistant, great. If I don't, that's fine. And the fewest amount of tools possible. And the smallest amount of blood that I need to clean up as possible. I like the simplest that I can make it. And so when I add music and when I add, conversations about basketball and stuff, it's increasing the complexity and turning up the noise. It's like white noise. It's turning up the noise that I think impedes my ability to work. But I love all sorts of music. I mean, don't get me wrong. I play music, and I know Jesse plays. I think you play bass guitar,
I
and
did.
I
Yeah,
play,
I played bass for a
electric
while.
or yeah. Bass guitar, she plays bass, and I play electric guitar and acoustic guitar, and also, so maybe we're gonna have a band sometime. I don't know. We might write some
I will
morgue
say
themed
this.
tunes.
I completely agree with you about but that, I mean, kind of like what I was saying with Motorama specifically. And like, and when I use, you know, that specific band, like that's truly like why I'm using it, is because the mood that they put me into is like you said, solemn, pensive. Like I'm not,
Hmm.
that it's kind of just, that's the mood it puts me in. Like I said, whether I'm painting, whether I'm writing, like I don't want extra talking. And I feel like if you're really truly paired with somebody when it comes to like autopsy technician and pathologist, if you two can communicate telepathically, which is something that just happens when you know death the way that we do, um, that, yeah, that is ideal for an autopsy.
Yeah.
So I feel like like I completely understand, like I agree with your classical music in the morgue too. So classical, Motorama specifically, or silence. I completely agree with that, state of mind and frame of mind
Yeah.
when you're doing this.
And personally, I don't have like a situation where I'm going to yell at somebody if they say, Dr. Wolf, can I put some music on? I'm going to allow it. I'm going to say, sure, if you want to play some music, let's do it. I'm not that much of a baby, but I work alone a lot. I
Mm-hmm.
do a lot of my cases either with one assistant in the morgue who is like a deputy coroner who just sort of hands me things. And then my hospital cases, I'm usually completely by myself.
Mm-hmm.
And so yeah, I just enjoy that silence. I don't know that I can ever fully put into words, and this is going to be weird, just how much I enjoy anatomical dissection. Um, and there's something so precise about dissecting out a nerve or an artery or a vein without bursting it open
Mm-hmm.
or a little muscle or a vertebra. Absolutely love it. I think that, 200 years ago, I would have been one of those guys that was the classic anatomist, bring in the body and give it to me before it decomposes and I'll try to dissect what I can. Um, but yeah, I don't know. It's become almost an ethereal kind of religious experience for me to do these cases. And I know that's putting a lot of weight on it because some people are like, man, just go to the morgue and do it and leave. But I don't know. I feel like it's that important to get it right because ultimately I'm not there for my enjoyment, although I do enjoy it.
Mm-hmm.
I'm there to help other people. For every death we have, there are people usually who are upset. They're shocked. They're saddened. They need closure, that sort of thing. And I feel like it is truly a service to do that. I'm not there to serve myself. I'm there to serve somebody else. And so when I start adding in lots of music and all this crazy stuff, I feel like it's more for my enjoyment than it is. It would be like, I'm going to your birthday party, but I'm choosing the cake that I like, not that you like. That's kind of how I look at it. So yeah, I know that's a boring answer. And Ariel asked that one. So Ariel, I know I seem like a boring guy, but that's just the truth. The truth is, that's how it's become for me is I now work in silence and sometimes maybe I talk to myself a little. I definitely don't sing. So there's really no musicality from that perspective. But yeah, that would be bad. That would be, some kind of sacrilege. But yeah, so that's my answer on whether or not I listen to music. I'm open to it, but I don't go out of my way to do it.
Let's see. What made
So
what made you want to go into pathology? It looks like that's from Sarah Sandreessen. Also, I wanted to say,
mhm.
because I didn't get to say this on the last episode that we did, Sarah noticed that I put my coffee mug directly on the table behind me, and she made me this beautiful crochet little skull, which is like, you're so sweet. Thank you so much. That
Well,
was
pe
lovely.
that's really nice. Yeah, people are so nice. And I was talking to Jesse about this a little bit, and I was talking about just how much people notice the way that we do things, or the way that we're sitting, things behind us, things that I'm wearing. It made me a little tiny bit self-conscious because I didn't realize how much people. I can't imagine if we had an audience of like a million people, people would be. We'd probably hear a lot more stuff like that. Like, hey, Dr. Wolf, you need to shave or you need to do that. You need to wear a different color shirt or whatever. So, So yeah, that thank you, Sarah, for that. That was very nice. But I'll tell you, first of all, I'll tell you my comment on how I ended up in pathology. And this is really, I'm going to try not to do too much of a soliloquy here, but it's a very big answer. But I'm going to try because I think when she asked the question, she said just a quick story. So I'm not going to go into the entire philosophical reason why I am a pathologist, but I will tell you that a story in just a moment. But one personality trait for me is that I like knowing the answer. I don't like guessing at an answer. I don't like leaving things to chance. I think if I weren't in this particular science, I might be a physicist or a mathematician because that they need the exact answer. They don't want like some variable that isn't answered. And so the thing I loved about pathology is that most of the time, now I should say most, greater than 95% of the time, we get the answer. And comparing that to other forms of medicine, some forms of medicine aren't so much about like the answer as it is like the acute treatment, setting a broken collarbone or, setting a broken arm, repairing a laceration, draining a boil, curing a pain from a kidney stone, stuff like that, which by the way is all stuff that I'm very impressed with. I was going to go into ER. I switched to pathology at the last minute. I can tell about that story some other time. Um, but it does actually play in to my story that I'm going to tell you. I I'll try to be brief. I was going to go into emergency medicine, and I had taken multiple rotations in emergency medicine. I had worked in the Methodist Hospital in Indianapolis and the Wishart Hospital and some other smaller community hospital to get the full balance of it. And what I liked about it is there was so much to do and so many different procedures that you would learn about that you had to perform, and you had to know so much about medicine. Well, as it turns out, pathology is still that sort of thing, except it's not as acute. Like you're not actively intubating someone to save their lives, or you're not putting in a chest tube to save their lives. But what happened was, at the very beginning of my fourth year, in the first couple of months, I had a rotation in pathology that I signed up for because it was said if you take a pathology rotation, it's so laid back that you can go interview for your residency programs. And so I said, I'll take a pathology rotation and I will take that time to go interview, take days off, 4 or 5 days off to go interview around the country. So on my very first day of the pathology rotation, I'm sort of waiting around. They've got me sitting at a microscope looking at slides, and I just sort of don't really know what I'm looking at. Well, in walks the pathologist for the day who's going to work with me. And she's a lady, kind of middle-aged lady, a very experienced pathologist, very jolly sort of pathologist. She's, always smile on her face type person. And she says, "Come and look at this case with me, Darin," because, I wasn't Dr. Wolfe yet. And so I sat down, and what happens is when a pathologist teaches with a student or a resident, there's usually a two-headed scope, or sometimes it's a multi-headed scope. So she was on one end of the scope, and I was on the other end looking at what she was looking at. So she puts a slide up there and puts it, gets it into focus, and she says, "Dr. Wolfe," or sorry, she says, "Darin, what do you think this is?" And of course, me, I haven't had histology since the first year of medical school. I'm sort of scrambling. It's been 3 years since I've seen this stuff. But to me, it looked like skeletal muscle, or it looked like some kind of muscle. So I know that you don't really sample muscles during autopsies, so it had to be something muscular within the body. So I said, "I think it's heart." She says, "Very good. It is heart. But what's really going on here?" And okay, so now we're getting into pathology. I'm like, oh gosh, I don't know. And my eyes are darting around, looking at I'm looking at the cells, I'm looking at the nuclei, I'm looking at the blood vessels, and I'm just trying to come up with anything. And I just said, "I'm sorry, I really don't know what's going on. This is my first day back in doing this in a few years." So then she switches to a higher power objective. So she was at 10x, or which is technically it's 100x, and she goes to like 200x, and she says, "Now do you see it?" And so what I see in the field is I see a blood vessel. Clearly, it's a blood vessel. And I'm like, okay. blood vessel. And she says, yeah, but what's in that blood vessel? And I completely had glazed over what was in the blood vessel. I look in the blood vessel and there's these sort of dark, large, ugly looking cells. And I said, I don't know what that is, but that's definitely abnormal. And she says, yes, this is from an autopsy case. And she says, this is cancer within a blood vessel. So lymphovascular or angiolymphatic invasion within the heart. So this is a malignant tumor within the blood vessels of the heart. And she said, when I did the autopsy on this lady, she had died. They didn't know why she died. And she said, I found a breast tumor. And so what we saw that day was we found metastatic breast carcinoma within the blood vessels of the heart, meaning that tumor was breaking off into the
Right.
bloodstream and it was shooting everywhere. It was probably in the brain. It was in, if you look in the spleen, if you look in the liver, you're going to see those little clumps of tumor cells everywhere. And that moment for me was so powerful because that little observation, it showed you this is the nature of cancer. It said, these little cells, there's probably six, seven cells, maybe 10 cells there. And they they are spreading throughout the body. So if you see that in the blood vessel of the heart, they're going to be in the blood vessels everywhere else. This lady essentially had so much tumor burden in her body that, her body basically kind of went into shock and died. She may have had a coronary occlusion as a result of, I didn't get the full details of the case because I was just there to observe that day. But it was so powerful for me to see that, this is the mechanism. This is how this disease works. It made me say, I want to know how every disease works. I want to know not just the ones that kill you, because I'm a forensic pathologist now, but I was a surgical pathologist beforehand. So we looked at some more slides for a couple hours, and I remember I went home and I sat in my apartment and I thought to myself, you're not going into ER. You're going to go into pathology. This was absolutely stunning. It was awesome. And so I come back in the next day, somewhat sheepishly, and I say to her, hey, listen, I've already applied for ER. I've already interviewed at a couple of places. Is it possible? Do you think it's possible for me to switch into pathology this late in the game? Which, by the way, is very bad idea to do that. You don't want to switch residency so late. I was
Yeah.
probably like October or something like that. And she said, "Well, let me call around." So she got on the phone and she called a couple of residency programs and she said, "Hey, I've got this guy here who seems to really want to do this. He really seems to know what's going on." And she called around, and the residency programs were like, "Yeah, we need more pathology people. So tell him to go ahead and apply." So what I did is from that moment on, I really focused like that rotation. I was really hitting it hard because obviously I need recommendations now for pathology, but also I went ahead and set up a couple of pathology rotations, a couple more at the medical center, and I just loved it. I just absolutely loved it, and uh, it just kept growing and growing and growing. And that was back in 2003. So we're 23 years away from that moment. And I remember it was in May, or no, it wasn't in May. It was in, I think, October of 2023. And I made that decision. And it was great. And somebody asked me yesterday, do you think this is your dream career? Do you think that you would do something else? And I said, well, dream career. I mean, who wouldn't want to be a rock star? Who wouldn't want to be a writer? I mean, okay, but if we're talking about medicine, yeah, this, I can't imagine doing anything else in medicine. Now, could I do other things? Of course I could. I got good grades. I learned medicine. I got good board scores. I could do pretty much whatever I wanted. But you don't want to do something just because you can. Uh, I could have applied and been a dermatology resident, but I don't like dermatology. So I
Right.
said, what satisfies my skills? What is going to be intellectually interesting to me 20 years into the future? And that's a hard thing to predict when you're a young person because you just want a job. You just want to get out of school and be done with it. And I said, I think in 20 years, I can still be interested in pathology. Whereas in emergency medicine, I saw some of the middle-aged emergency medicine docs really burning out. And they were open about it. We are burning out. And I said, you know what? I want to try to go the distance. So fast forward, here we are, 23 years later, and I still love this job. You can ask anybody who works with me. I know some of them listen to this podcast. I have seen a ruptured myocardium causing a cardiac tamponade with blood filling the pericardial sac like 100 times. And every time I see it, I'm like yelling. I'm like, yes, this is awesome. You know what I mean? Like it's just such an
Yeah, yeah, yeah.
interesting pathologic finding. It's not that I'm celebrating like a touchdown dance or something, but I get very excited because now, why do I get excited? Now we will be able to tell the family exactly what happened. It's the cases where you can't find what happened. Those are the ones that disturb me and keep me up at night. So, long story short, Sarah, that is the moment when I decided I had to do this. And then now, 23 years worth of moments later, I'm in this position right now, and I'm really enjoying it. So I can't complain too much, and I would recommend it to anyone listening. If you want to go into forensics, we need more people. We need more techs. We need more forensic scientists, and we need more forensic pathologists, please.
Yeah, I mean the need when I went to that forensic convention a month or two ago was, yeah, like dire need for pathologists specifically, but also just anybody that wants to work within
Mhm.
death care.
Yeah, I mean, it's the problem is, and I'll tell you just really quickly, I think the problem is that we are exposed to a lot of media that is like emergency room type medicine or surgeons or, Grey's Anatomy type stuff where, the excitement is out on the floor. It's in the wards. It's, saving a child and having the mother, give you a hug and say you're the greatest of all time. And there certainly is a lot of value in that. But I guess for me, it was a little bit of it was an intellectual curiosity thing. Like, can I maintain this level uh, of skill? Can I maintain this level of interest and also serve society? And I felt like that was my gamble. And fortunately, the gamble paid off. I know not everybody in medicine makes the correct choice. I've had a number of fourth year medical students rotate with me and then say they wish they had done this. So, I always tell people, please take a pathology rotation during your medical school education because it may be interesting to you. And again, that's part of why I'm doing this podcast to begin with. I started this in 2020 because we were all locked in secondary to COVID. We didn't want to get out, and I had to do something. And I thought, well, this will be a good way to reach out to people and let them know a little more about this field.
Mm-hmm.
And so, Jesse, I don't know exactly when you started as an autopsy tech, but what kind of pushed you into that realm
Mine
to kind of
is,
say, I want to do autopsies?
yeah, mine's slightly more depressing. So I'll try to not bum everybody out, but
Well, if you don't want to talk about it, you don't have to. Well, I was going to say, if you don't want to talk about it, you don't have to. But since she
no,
asked both
I'll,
of us, I just thought, yeah.
yeah, I'm okay with talking about it. So originally when I was in college, I was an English major. So I was studying, and at the time that this all happened, I was studying British literature, poetry, those kinds of things. And I've always been very passionate about that. I love writing, but I'd always loved like anatomy. I remember when studying, Da Vinci, Michelangelo, artists like that. The fact that they were dissectors prior to being artists,
Right.
um, which then informed their art, was always like just absolutely fascinating to me, and I loved it, and I loved that. And even now, the marriage of art and human anatomy is very important to me, and it's something I always try to incorporate into pretty much everything I do. But so I was in an abnormal psych class at the time, and I got a phone call from my mom that my uncle had shot and killed himself. And very devastating. There's a lot of artists on my dad's side of the family. He was one of them, and there's just something about the boys on that side of the family that just don't
Hmm.
do too well. And so I then kind of spiraled. I went from being, top of my class, to I would
Hmm.
drive to school and I would basically just cry in my car and never go in. I started failing my
Hmm.
classes mainly just because I was at home, like hiding, trying to cope with what had happened in my family. Um, and at that, I can't even really tell you for sure what made me go, okay, this is the moment that I switch from my artsy major straight to anatomy and biology and all of that. So,
Hmm.
um, yeah, I remember finally kind of like waking up, I guess you could say, because again, like I was really struggling. I went from being again top of the class to failing. That was when I think my abnormal psych professor was the one that noticed something was wrong, and he was the one that kind of went to the board and just basically like vouched for me, which forever
Hmm.
thankful to
Right.
him for that. But so I wrote a letter just saying, somebody in my family took their own life, and it like threw me for a loop. And so, but yeah, from then on, I was fully immersed in anatomy. And I just remember wanting to be, one of the people that had my hands on the body after something like that happened, because it's just like, I know what that feels like to have something
Yeah.
horrible happen, something tragic happen. Like all death has a level of tragedy to it, but taking your own life is a little different. And so I just always wanted to be,
Exactly.
yeah, yeah. So I was always wanted to be
Well,
like the person in the room that
yeah.
was aware of that.
I think your story is one that is actually relatively it's definitely relatable and it's common because people sometimes become more interested in helping that side, whether it's mortuary science or what we do because of a death that they've had.
Hmm.
One of my podcasts, actually, and I know that a lot of people have listened to all of my podcasts, but there's a podcast I released, right? I think it was in 2021, where I talk about how I experienced the death of my grandfather as a 5-year-old, and I didn't really understand it, which then caused me to be very interested in disease and death because he had an unusual cancer. And I was 5, so what did I understand? But it caused me to want to read medical books. And so even when I was 7 or 8, I would get medical books out off of a shelf or, in a library, and I would read them. And so I think, like you said, if you've experienced like a traumatic event and you know that the forensic realm is where there is a lot of trauma there. And I'm not talking just about physical trauma. I mean, like the emotional trauma shows up on the table. The whether it's the taking of one's life, substance abuse, the endpoint of substance abuse or things like that. So I think in some ways it can be extrapolated to the same reason why a lot of oncologists become oncologists because they had a family member die of cancer. And sometimes neurosurgeon, somebody in their family had a brain injury and they had to have neurosurgery. They had a brain tumor and they had to have neurosurgery. It causes them to go become a neurosurgeon. And so I think having that experience definitely it kind of it is an act of humility. And then it's also good, I think, to have people at least in our field, in the morgue, who really understands what's happening on the other side of it, which is you are at the intersection of a traumatic event for somebody. Usually, everyone has somebody and who is devastated and very upset by the death. And so you are kind of a steward in a way to make sure that you are doing all that you can, whether it's as the tech or as the pathologist or as the deputy coroner or the medical examiner, to make sure that all of the things that you can do to help them get through this. Because what can we do? I mean, at this point, the death has occurred, but we can tell the story of what happened. And that is actually a very important element of closure for many people. Sometimes they know okay, it was a car accident, or they know it was some kind of heart related thing. But what really happened? How long did it take? Was it painful? These are questions that we get. And so I think that your story is very And I didn't actually know this. With Jesse and I don't talk about everything. I didn't know this, or I didn't know if whether you wanted to talk about it or not. But um, it definitely makes a lot of sense why that would push you in this direction. And I think that there are a lot of listeners and viewers who will probably share a similar story, which we would be interested to hear if you want to talk about that. I'm sure you could message us or share your stories with us, and perhaps we could do more episodes on that element of it, which is
Oh,
more of
for
the
sure.
emotional impact. Oh yeah, yeah, the emotional impact of this career. But thanks for sharing that, Jesse.
Yeah, of course.
Yeah.
Okay, and then the next one,
Um,
let's see. Do we have plans to come to CrimeCon from Jason Mulvaney, which is also kind of a piggyback off of, again, Sarah Sandreessen? Will we do live events?
I when we were picking out the questions for this particular episode, I really liked these because I've not been asked this before, nor have I talked to Jesse about this. Um, when I see people at crime cons, and I do see forensic pathologists show up there, I just assume they're invited. So I've never been invited to go to a crime con or a true crime, conference or any of this stuff. So no, I've never went. Would I be interested? Sure, sure, I would absolutely be interested. Jesse, I don't know. We haven't really talked about it. What's your feeling on going to some kind of conference? Related to what we do.
I would love to. The only thing I will say that you and I did talk about, and it's just this like wild, fantastical dream I have of wanting to do a live event. Doc and I
Oh
are
yeah.
both huge fans of, you know, being relics of the past as we are. We love anatomical theater, and I feel like it is a
Mm,
dream of mine to somehow do anatomical theater, but for listeners. And that
mhm.
way I feel like it's, and don't get me wrong, I understand that like lots of people love their podcast hosts that they listen to. So going and listening to them talk live would be fun regardless. But when it comes to us specifically, I really just want to offer something else. So if you do come to see us, it's not just us talking at you like we're doing here. Like you'd actually get to see something that you wouldn't get to otherwise from like a scientific perspective. And I don't know that what the specifics of that would be, but if you and I could resurrect anatomical theater together, I think I would die of happiness.
Oh, yeah. And so for those who aren't necessarily sure of what she's describing, we're literally talking about doing like they used to do 200 years ago, where the body would be there and we would be teaching and dissecting for an audience.
Mhm.
Um, that is something that she has mentioned that to me, and I was like, oh, wow, okay. That is definitely a big goal, and they do those sometimes right now. I've seen footage, a couple of screenshots and stuff from people doing those. Frankly, I don't like the technique that I'm seeing. It needs to be done by like a real
That's a
professional, not
different
just
conversation.
you know that's a different conversation. But yeah, so the pie in the sky idea is that we do an actual live event where we do that sort of thing respectfully. We teach. It's not a show where we're dancing around with the lungs or whatever. So yeah, we definitely would like to do that, but on a more achievable scale. I mean, in theory, I am going to have a book finished this spring. I don't know exactly when it's going to be done, but it would be cool to do some live events, sign some books. That would be a dream of mine, actually. I wrote a book, but it got released during the pandemic, so I wasn't doing live events. I wasn't going sitting at Barnes and Noble, which would be incredible. So yeah, if we end up at a conference, maybe I'll have a stack of books. We can sign, we can talk about forensics, true crime cases. You can argue with me in person. It'll be fantastic. So I guess my comment to that is I haven't looked into it in an aggressive fashion, neither has she. But if you are interested and you will want us to go, and it's a place where we could both be at the same time, I would certainly be open to it. And I think Jesse might too. So 2026, I guess message Jesse or message me and tell us if you're interested in that. And perhaps we could try to make it happen. I know a couple of my forensic colleagues go to these, but
Mhm.
I always assume they're invited. I always assume they're invited. Maybe they're inviting themselves. I don't know. So let me
Yeah.
know.
Okay. This next one is from Susan Deitch or Deitch. I apologize if I'm absolutely butchering that. Is Dr. Wolf self-employed, or working for a particular agency?
So first of all, on the pronunciation of the last name, you can message us and tell us the proper one. Jessie and I, she thinks it's Deitch. I think it's Deitch. So please let us know who wins, and then Jessie will owe me a Coke or something if I'm right, and then if she's right, then I will get her something. So it's a great question, and I'm glad you answered. I am self-employed. I am my own boss. I own my own company. It is a company in which I can do forensic consulting, legal consulting, or surgical pathology consulting. And I have owned that company since 2015. And by the way, that sounds really fancy. It sounds like I've got a big downtown office in a high rise. I don't. I am just one person. I occasionally hire techs here and there, transcriptionists here and there. It's really a simple operation, but I am technically the CEO. And I am also the chief pathologist, but I'm also kind of like the only employee too. Now, how does that work with agencies? So, although I am self-employed and I am technically an independent contractor, I can go work for anyone who wants to hire me. So this month already, I have worked for a family, a private, that's called a private autopsy, where they actually look me up online or they call somebody and they say, well, I want Dr. Wolf to do this case and tell me why my wife died or whatever. So there's private autopsy, there's government autopsy, which would basically be like coroner or medical examiner. My state is a coroner state, so I do coroner autopsies as the bulk of my work. Probably about 70% of my work is coroner autopsies. Um, and then the other would be hospital autopsies. So these are clinical cases, people who are in the ICU, maybe they have an infection, we don't really know what happened, they die, family wants to know what happened, or somebody comes in urgently to the ER, they do a brain scan, they see a brain tumor, and they want to know what the brain tumor is. And I will get called in to do those. So they're kind of different, actually. The hospital cases, a lot of people don't realize this, are actually the most difficult autopsies of all of those that I mentioned, because they're usually asking some really specific, kind of insane question for me to find out. And usually those patients have 20 medical conditions, and I have to figure out how they died. So I work for anybody who wants me to work for them. That's basically how it works. And sometimes it's law firms, and sometimes it's hospitals, and sometimes it's coroners. So to answer your question, I am not, I pay myself. In other words, I'm the boss. I don't have the government like paying me directly, but they contract with me. So sometimes people ask this question because they want to know, am I being paid by like the cops? Am I being paid by the government to give a certain answer? And I'm not saying that that's why she asked that question, but I do get that question because I've had people imply that my results are not valid because I do them for the government, the coroner, or whoever. Because there are people out there that say you can't trust the government no matter what. And I'm just a simple pathologist out here trying to figure out why somebody died while mowing their lawn. There's no conspiracy. No matter who pays me, I'm just here to get the answer. Well, and on that note, it's really important. There's a growing percentage of our country that, um, doesn't believe. Like if I say that they died of pneumonia, okay, it wasn't pneumonia. This is a government conspiracy. That's why, for those listening who are in this field, always document everything as much as possible with pictures, audio, writing, copy everything. Make sure you've got all the evidence because what I've noticed recently are lots of families, I shouldn't say lots, a higher percentage of families that don't believe the answer and then they want it to be independently investigated. And so the best way to basically show that you are correct is to have all of your data and say, please have a look at it. And then have a pathologist look at that, and then they'll realize that everything was done correctly. So the long and short of it is you have to assume that your stuff is going to get looked at if you become a forensic pathologist. Someone is going to review a percentage of your cases. whether it's for legal purpose or it's the family just doesn't believe the answer. And that's just part of this field that we don't talk about too much, but it is a reality of this field. So yeah, self-employed, but contracting with everyone who wants me to.
Alrighty. And this next one was from Jenny Traw. So she had a biopsy of her esophagus because there's a suspicion that she might have something called Barrett's esophagus. And that was stained with an Alcian blue test. And she was just curious what
And
that
she wants
process.
me to explain it.
Yeah,
Yeah. So I got really excited about this question because at
I did
heart,
too.
I was a surgical pathologist. Yeah, at heart, I was a surgical pathologist for many years. And I want to say that this question is in no way forensically related. This has absolutely nothing to do with forensics. So anybody listening, you're going to learn something a little bit about surgical pathology and pathology of the GI tract in particular. So I got excited because we used to do Alcian blue stains a lot, and I know
Mm-hmm.
Jessie used to do Alcian blue
Yep.
stains. I think when she was working in the lab. So what is it? Why is it done? First of all, let me say that it's Barrett's esophagus, not Barrett's, but it's sometimes they say Barrett esophagus,
Mm-hmm.
not Barrett's. It's a nomenclature. It's a nomenclature thing. Don't worry about it. But what does that mean? So that is technically what is known as intestinal metaplasia. Okay, so what is metaplasia? Metaplasia is when a tissue type forms at a site where it is not supposed to be. Okay. So sometimes you can get bone forming inside of muscle and it's like osseous metaplasia, or in this case, you're getting lining of the intestine in the esophagus. That's a different thing. So the esophagus, let me explain, is lined by squamous epithelium, and then it becomes columnar epithelium kind of at the gastroesophageal junction. So why did she get Alcian blue? Now, here's where we get into the actual technical stuff. So your stomach contains acid, hydrochloric acid. If hydrochloric acid refluxes into the lower esophagus enough, it is quite irritating. It's painful for you, but it's also irritating for the esophagus. So your body has a way to try to decrease that irritation. And that is, it changes from squamous columnar epithelium into intestinal epithelium. And how do we know that? Because it forms a special type of cell called a goblet cell. I should have really come down and brought my goblet to drink out of this evening. It's called a goblet cell because I do have a goblet and I'm that kind of guy that drinks out of a goblet. So it's called a goblet cell. And what happens is the goblet cell contains a lot of mucin. Okay, that sounds like mucus because it is. It's a sticky kind of substance. The mucin is negatively charged. And what happens is this stain is positively charged, aka cation, and it binds it and it colors it blue, hence the name Alcian blue. So now all of that stuff, what does that mean? It means that you have esophageal reflux, you go get a scope, the gastroenterologist biopsies the area between the stomach and the esophagus, sends it to the pathologist. Pathologist looks at it and says, I think those might be goblet cells there. There should not be goblet cells in this region. So how do I prove it? Well, if it's indeterminate, you can't prove it by looking on H&E stain. You do the Alcian blue, and it lights up those little globules of mucin blue. And at that point, you can make the diagnosis of intestinal metaplasia. Now, Jessie, I think, has some images she wants to show us of what that looks like for the people who can see the screen. And for those of you who are listening, I can tell you that there's imagine little spheres of inside of the cells, and those spheres have a bluish color because of the stain. That is because of the mucus,
Now tell me which one you
or
want
the
up here because I
mucin
got a
rather
couple.
is the. Go ahead and go to the one all the way on the left. This is just to show basically the colors of that particular stain. Um,
I was thinking more like a
if it,
painter
I
when
don't
I
know, it
grabbed
looks
that
like,
one.
Yeah, no, I like that because it shows the color quite well.
Yeah, the
Has it come up
contrast.
for you? It's not coming up for me. I see
Not
it on
coming
the
up. Okay.
screen, but it's not blown up. Let's put it that way. Should it be blown up?
Yes, it is. So I'm not sure why it's
It
not.
okay. Well, for me, it's not blown up. Perhaps it is uh, on the regular viewing. But even so, even if it's not blown up, you can see that the glands have a bluish color to them. That's because of the mucin. But the actual intestinal metaplasia case is going to be the one on the other side, completely on the right. So let's see if that one comes up. And so, what this, for the ones who are listening, the glands form kind of crypts that go down into the epithelium, and they are lined by a cell that is a column shaped. And within that cell, there's a little sphere or oval that is blue, and that's where the mucin is. So when the pathologist sees that, they can make the diagnosis of usually they say intestinal metaplasia, parenthesis, Barrett's esophagus, close parenthesis is how we put it in the report. I had to dictate that for many years. On my end, Jesse, it's not blowing up. Perhaps it is for the viewer once this hits YouTube. But even if it isn't, it actually, you can still see what I've described.
Okay.
And the listeners, obviously, you can hear what I described. So I'm not sure exactly why it didn't pop up,
I know it did the
but
last time when we did the,
yeah.
yeah, I'm not sure why it's not wanting to do that.
It might look better when you upload this later, but let me take it one step further why this is important. So you're probably thinking, okay, Dr. Wolf has talked about this. Why should I care? So when you get intestinal metaplasia, now you've opened up a new realm, a new possibility for pathology, and that is when that occurs, you can now develop what's called dysplasia, which means abnormal growth within the lower esophagus. And then dysplasia can become progressively worse. We go from low grade dysplasia to high grade dysplasia. And after high grade dysplasia, that's where the trouble starts. That's called adenocarcinoma when it goes beyond high grade dysplasia. And so high grade dysplasia uh, is, like I said, when you go beyond that, it becomes cancer. So adenocarcinoma is a cancer. The point being, long-term untreated acid reflux can cause adenocarcinoma of the lower esophagus. And that is a very dangerous tumor. Now, I know you're listening, Jenny, and you're probably thinking, oh my gosh, I'm scared. This guy's scaring me. No, you shouldn't be scared. If you control your acid production, the amount of reflux that's occurring and things like that, you can actually cause that intestinal metaplasia to go away and turn back into the regular epithelium that's supposed to be there. And then your cancer risk goes away. The reason why that biopsy and that test is so important is so that your doctor can know to follow you. So if you have Barrett's esophagus, your doctor will say, okay, we've got to get your acid down. And they're going to prescribe some kind of medication, dietary changes, lifestyle changes to diminish that. And then you might go back for a scope X months later to look and see if that Barrett's esophagus has gotten worse or better. If it's gotten worse, alter the treatment. If it's gotten better, keep what you're doing. That's how it'll work. So that is a very simple chemical test that we can do. The pathologist, the histologist can perform, and we can give information to the clinical doctor who can then carry on that treatment to you. And the reason why I got so excited about this displays what pathology does in the hospital. Okay, it displays not everything, but it displays a good bit of what we do, which is pathologist gets specimen, pathologist interprets specimen, pathologist reports that to clinical doctor makes decision, patient gets hopefully better based on that information, or at least gets proper treatment. So I love it because it shows the chain of events that we try to do as pathologists. Now, I do miss surgical pathology. I I am a forensic pathologist now, but I am also at heart a surgical. And I'll always love those years that I did it because I got to do that every single day, dozens of times a day. I would be able to say, I diagnose that cancer. I diagnose that intestinal metaplasia. I diagnose that inflammation. I diagnose that, eosinophilic infiltrate, and the doctors can make changes based on that. And to be honest with you, I don't know why more people aren't interested in going into pathology. Number two, I'm also shocked at how many doctors don't seem to care that much about it. I try to be a strong advocate for pathology, and that's why I like this podcast. I like talking about this stuff. And although this is really more of a forensic type podcast, I will accept surgical path and clinical type questions, and we can talk about them.
Yeah, please
So
do,
thank you,
because
Jenny, for that. Yeah,
we both worked in surgical pathology. Obviously, I was more of like the lab
yeah,
individual. I was a cytotechnician, but I also did a little bit of
yeah.
histology, and then I worked in family practice. So actually, I would often tell people kind of the process whenever they would have to get biopsies with,
Hmm.
with us, that, kind of walk them through it, just because, yeah, it is scary to get, a biopsy, and people are throwing words around
Yeah,
like tumor, and it's like, it's nice to be able to give
yeah.
people
Well,
answers
and the
that they can feel
language.
comforted. Yeah.
Yeah, well, exactly. Like the language of pathology, it is a different language, and it's a language that the clinicians hopefully know, but at minimum, the clinician has to distill that information to the patient. So if I say that this is a moderately differentiated adenocarcinoma of the esophagus, eroding through the outer layer of the esophagus into the periesophageal lymph nodes, that that is a pathology statement, but the clinician has to be able to take that, translate it, distill it down to the simplest thing to explain to the patient so that they know what's going on. And unfortunately, there's a big breakdown in medicine, and it's always existed. And so, again, this is nice because it explains. People say, "Why do you talk about this stuff online? Why do you make videos?" And this is why, because I want people to know what this means. And people, if they know what it means, I believe that they can have better health outcomes. But for whatever reason, over the last 125 years, people don't seem to put a lot of stock in the importance of that interaction in medicine. It's just the biopsy goes away, it goes into the ether, and then it comes back with an answer. But we're the ones in the ether. So, so at any rate, thank you for that question. I think that's enough for tonight,
Hmm.
for that particular episode. And I want to tell people that we have a lot of questions that have come through.
So
So
many.
if you did not get your question answered, yes, if you did not get your question answered for this episode, we will be able to answer it in the next Q&A that we do. And probably it could even get booted to the next Q&A after that one because we've got 20 or 30 questions. And they all are deserving of, thoughtful, good answers. And so anyway, I hope everybody listening today has enjoyed this. I hope you learned a little something. I certainly like the Q&A format because it allows us to just completely just hit a bunch of different topics all at once. And these, I don't get as much hate mail as when I describe do go through true crime cases because people always have their minds made up on true crime cases. So uh, you know how it is. I'm used to it now. Well, maybe I'm not used to it because I don't really like people who don't understand my job telling me how to do my job.
It is, that part
But
is
it
that
is
part's
what it
always
is.
fascinating to me, where it's like, you've never set foot in a morgue. Not only have you never dissected somebody, but you've never been like a part of that entire process, like with a case. And then you want to sit there and
Yeah,
chirp at two
right.
people who have, and I don't get that. So it's just like, I'll never
Yeah,
understand that proclivity. But one more thing I
probably.
did want to
And
say
this
though
is
in
we
regards
are
to
gonna.
that
Yeah.
is, we both
Mhm.
said this in both episodes. So, and I don't know how to make this any more clear, so I'll just try one more time. We do not have a dog in the fight of, is it murder or is it somebody taking their own life, in terms of
Yeah.
anything outside of the facts, right? So, what
Mhm.
is the truth? That is the only thing that he and I care about.
Yeah.
If it ends up being there is more evidence that was not made available to us for whatever reason, we will both change our minds. That's how science, that's how evidence, that's how facts work. But right
Yeah.
now, you have not
Yeah.
done the requisites to convince either one of us that that was anything other than somebody taking their own life, unfortunately.
Yeah. Yeah, and where just the key of science is that when you receive new data or new evidence that can help you make a different decision, then you accept that, you assess that, and then you decide, is this enough for me to change course on my interpretation? And like she said, until we see that, it's not going to happen. And
Mm-mm.
anybody who already issued an opinion there, it's not going to happen for them either, because you have to be shown something that makes you say, aha, okay, I get it now. So yeah, that's part of the reason why, I mean, I don't do a ton of true crime type uh cases. I've seen a number of people online interpreting autopsy reports who do not have any much at all, if any, training in forensics, and I really think that's dangerous because the public is getting incorrect information from people who are unqualified but believing what they hear. And I'll tell you, that does irritate me a little bit.
Oh, yeah.
But that's a story for another day. So, quick reminder, you can watch us if you're listening. You can watch us Knife After Death at YouTube. I have a Substack called Dr. Darin Wolfe. I think it's called Autopsy and Forensics Substack. You can go there. If you subscribe, you can see some stuff I do at Autopsy, the actual like gruesome stuff. Like I do a Forensic Friday, and on Forensic Friday, I show an image, and it's usually always from an autopsy. But that's behind a paywall because I can't have that stuff just floating out on the internet. So there's that. Instagram, the Dead Letter, TikTok, sort of like if you search the Dead Letter or Dr. Wolf, I'll come up. And yeah, so look us up. And then Jesse's at Instagram as well if you want to give the addresses for that.
Oh, yeah. I'll put all of that in the show notes so you can pretty much just click on it. Like when you go,
Yes.
yeah, it'll be in the show notes on, excuse me, on our Spotify, Apple Podcasts, pretty much wherever you listen to podcasts, those show notes should populate, and then on our YouTube channel as well.
Yeah, and it's sometimes we put a little extra detail in there in the show notes. If you want to look at those, I mean, you're going to get like if we have resources, if we have any sources we've used in our discussions, ways to reach us. So please check that out. And I think that's probably it for today. I can't really think of much else we need to discuss. It's a good, we did over an hour, so hopefully people who are getting their hair done are still, they're almost wrapping it up while they're watching and listening. Maybe they're getting their nails done and they're like, finally, this guy stops talking. But yeah, I enjoyed it. I enjoyed it. So thanks. And we don't really, I wouldn't say that we have a set release schedule. It's just Jesse does it whenever we can. Like Jesse and I kind of phone tag our schedules, and then when we can do it, we do it.
Yep.
But we're hoping to have a little bit more regular release schedule going forward. It's
I
just
actually
as it's yeah.
sorry, I forgot about this. So
No.
one of the reasons that we've been so spotty actually a little bit is I don't want to make anybody like too excited yet. We did have some people, and I won't get into specifics, reach out to us about the possibility about this becoming more of like a televised series as opposed to podcast, but we'll see. There was one person we actually
Yeah.
declined just because of creative control, which is huge to both of us. And then,
Yeah.
but yeah, so we did have a meeting. So
Yes. Yes, and I've had a couple of people reach out as well, which I'm still trying to figure out how in depth I want to get, with that because I'm pretty big on creative control as
mhm.
well. I mean, I don't really like people, puppeting me.
Yeah.
That's sort of why I work alone. It's sort of why I'm a contractor instead of working for somebody else. But yeah, exciting stuff on the horizon. Hopefully, I think 2026 is going to continue to be a good year. It's a busy year. Everybody's very busy, but we're going to keep trying to produce. And I'm certainly doing better than 2025. So I guess I'm happy. We didn't do a whole lot in 2025. So I'm happy. 2026 is going well. So anyway, thanks for listening. And we will certainly we'll talk to you next time. I don't know if we're doing another Q&A next time, but we've got some subjects for possible regular podcast format. And so we're going to bounce it back and forth and figure out what we're going to do. But yeah, we hope to hear from you soon. And we'll be hopefully releasing another one this month.
Say, did you ever hear the saxophone let out an awful moan?